The meeting to order. Roll call, please.
Dale Schleter,
Here.
Marshall Savitsky,
Here.
Jesse Betcher,
Here.
Michael Maestri,
Here.
Chris Rusk,
Here.
Lorraine Gouget, Don Pettit,
Here.
Carol Pearson, Sabrina Dunlap. We have a quorum.
Okay, everybody please rise for the pledge of allegiance.
Pledge allegiance to the
Allegiance to the flag
States of America,
and the
Republic,
to the republic for which it stands,
one nation,
one nation,
God,
under God,
both
indivisible, with liberty and justice for all.
Madam Clerk, certification of compliance with open meeting laws.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. Meeting agenda. Does everybody have the current agenda? Did you want to?
would you move number 17 to under 12B?
Okay.
Okay. Do I have a motion to?
Second.
A motion and a second. Everybody in favor, say aye.
Aye.
Opposed? Okay, motion passed. Public comments. We have Mr. Schlender here, so Mr. Schlender, if you want to come forward, and you have 3 minutes.
30 minutes like we discussed.
3,
Just for 3, not the third.
3.
Good evening. My name is James Schlender. I'm here in the capacity as the Attorney General for the Lucudere Tribe. I'm here to address the Health and Human Services Committee of the Sawyer County Board of Supervisors. Specifically, I'm here to address a specific item that is not on your agenda, but that is under your purview as the Health and Human Services Board. There is a 161 agreement that is between the county and the tribe. 161 is federal legislation that deals with the direction of federal dollars, providing assistance to families for children that are in various stages of child protection, as well as funding, federal funding. And currently, our 161 agreement between the Lucudere Tribe and Sawyer County is under review. It's currently expired, and it's been a couple of months since we've had substantive progress towards a completion. The tribe has specific points of issue that need to be worked out with the county. One is there seems to be a practice of when cases that are deemed by our ICW director, which is the equivalent of your Child Protection Services director, refers them out to the county, they get, quote, screened out, and then nothing is done with the matter. There's no protocol or any process that allows for the potential family or child that would need services to receive any type of services. The 161 agreement requires some compliance on behalf of the tribe to isolate social workers from what would be decision makers on the tribal side, and the tribe has some point of contention with the definition of what that conflict is, and we need that to be fleshed out and clarified in the agreement itself. And the last part is the protocol for dispute resolution. Under the 161 agreement, the dispute resolution clause has the social worker responding to the call and the state social worker, the county social worker. And if they are unable to resolve it, it goes then to the director. And then the ICW director then can appeal that to it would be the equivalent of what they call the CPS director. And if that's not resolved, then they take it to the Health and Human Services director. And then after that, it goes to the executive director, who then meets with the county administrator. And then if that's not resolved, then the final step is the tribal governing board would deal with the county board of supervisors in totality. There's no mechanisms that define the different procedures that are in place. And the point of contention would be is that, with the exception of the social workers themselves, the rest of those people wouldn't have clearance to hear the matter. And so so there's a difficulty in terms of being able to legally hear that. So this is in front of you now so that you can share this with your human services team to take it up on their end to earnestly collaborate with the tribe to work out this 161 agreement. It's an age-old, decades-old document that needs some work and some attention and effort on both parts of the county. It's
Okay.
not on your agenda, so if you have any questions, you'll have to reach out to me later because your rules prohibit from you engaging with me.
Thank you. Anybody else in the public wish to? Okay, moving on.
Minutes.
Approval of last month's minutes. So everybody's had a chance to read them. We have a motion.
approval.
Thank you.
I'll second it.
Thank you. We have a motion, a second. Everybody in favor, say aye.
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 Anybody opposed? Motion passed. Okay, now we're on item 8. Which has disappeared. What is item 8? Oh, administration, okay.
Committee reports. LCO liaison.
Okay, yeah. I'm sorry. Lorraine,
Yeah, Lorraine sent a report, so I'll read it real quick, Chairman. She states the health center weekend 10/7/22, LCO had 6 positive COVID cases and 0 influenza cases. We're making good progress in getting Omicron, 5-1 COVID boosters and influenza vaccines into the arms of many patients that are attending this now. They're also in discussion and have warnings all for this rainbow fentanyl issue that apparently is coming. I don't know. Our health officer is aware of that, but it's a dangerous trend and it's can be in candies, wrappers, pill bottles, and laced with things. So they're warning the public and any patients to make sure that there's correct labels on your pill bottles. And that candy wrappers and anything like that have been sealed and nothing, you take nothing that's been opened or tampered with. So it's called, fentanyl. But maybe you know better.
Yeah, it looks like candy.
Looks like candy, yeah.
Or-
Okay, and then they've been doing a lot of Narcan training around reservation. Good, a lot of people showing up to the meeting.
Okay.
Thank you.
thank you. Any questions? How effective is Narcan over fentanyl?
Very.
It is,
Yes,
okay.
but it wears off 10 to 15 minutes. So once you treat someone with Narcan, they really need to go to the emergency room because they could overdose again when that wanes off.
Okay. Did you have a question, Patty? Oh, okay. All right, thank you. We'll move on. Senior Resource Center. Joey, are you here?
Yep, I'm here.
Okay,
We're here for the resolution for the bus for the 8521. It's that time of year again where we need to do the resolution for the bus. We did have the public hearing. And as in the past, I've done this for like about 5 or 6 years now. We had no one attend the public hearing. I don't know if they're not interested, I guess, in the bus, even though we're telling everybody today that there's no more rides this week because we're full. Tomorrow we have 36, which doesn't seem like a lot, but it is when half of them are wheelchairs or walkers and stuff like that. The grant from the DOT, which is a transportation grant, and it is the same amount that it has been the last 5 years with the amount that the county has to, the percentage that they have to put that grant, and it should be in the resolution. So it's pretty standard. It's been the same for, like I said, about 5 or 6 years, so. This committee needs to pass the resolution and then it goes to the county board for the county board to pass that resolution for the 8521 grant, which is due the end of December.
Andy, do you want to weigh in on that? Or,
No, I think it's consistent with prior years and county's portions within our budget amount to senior resource.
okay. Is this a supermajority necessary to pass? No, just regular majority. Okay, would anybody like to make a motion to approve this resolution?
I will.
Okay, a second.
I'll second it.
Thank you. Any discussion? Any
Yeah,
questions?
Mr. Chairman, I just have one question. It says it's recommended for adoption by the Sawyer County Board of Supervisors at its November 15th meeting. I'm just wondering why, if it's passed tonight at this committee, why isn't it going to the county board next week on October 20th instead of next month?
It typically comes to this committee during this time in October, and then it goes to the full county board in November for, the grant is due the end of December. It's typically the way we've done it, in the past, and I think one of the reasons why it doesn't go to the county board in October is because that's your board meeting where you're working a lot with the budgets and stuff, so we've just always done it that way, so it's not lost or encumbered with all the other things that go on at the county board.
Okay, thank you.
You're welcome.
Any other questions online? Anybody? Okay, everybody in favor, say aye.
Okay.
Anybody opposed? Motion is passed. The resolution is going to be passed on to the county board. Let's see.
Did you want Joey's report at this time too?
Yeah,
Okay, Dale had passed over, I had Dale, just kind of a little fact sheet about what's going on at the senior center. And what we're looking at, this year, we all realize that, the price of everything is going up. And as you can see, back in, 2020, 2021, is when COVID hit and prices started going up. In 2029, we served 33,335 meals. And the meal cost at that time was $10.55 with a suggested donation of $5 for seniors. And over 60, they were asked to pay the full price of the meal, $10.55 for under 60. In 2020, in the heat of COVID, we served 38,222 meals. That's when a lot of people were staying home. The feds had relaxed requirements. You didn't have to be homebound, needed assistance and different things like that. We are still under that declaration that anybody that calls and is a senior and wants a home delivered meal, we do it. And then over the last, and right now, so far this year, we're running right about the same. Right now, we're at about 23,000 meals. And if we keep going in the trend we're going right now, we will hit that 33 to 35,000 meals again this year. As you can see in 2021, we have to do for the feds every year, we have to do a meal cost analysis. And this includes the wages, the food, the packaging, the Meals on Wheels drivers. So right now for a home delivered meal, it's costing us $14.45 to deliver that home delivered meal. And that includes everything. For people that come in and eat at the site, that accounts for $14.35. And then we're still allowed to do carryout meals. And that amounts to $13.58, for those. And actually that $14 is probably a little low considering that prices of food are continually going up. And we have to constantly look at, okay, what can we do differently? How can we change the menus? Because, for example, we had asked the seniors every year when we do our menus, what would you like suggestions? And someone had suggested a certain kind of fish. We bid out that fish in order just to feed the seniors that typically come to Hayward when we serve fish would be over $500 for that fish, just for that day. That didn't include the other site. So we're looking at different alternatives, and one nice thing, the suppliers like Reinhardt, Upper Lakes and all of them are looking at different alternatives and different ways of processing their food. So we found some more cost-effective things to do, but there are some things that we just, we've had to cut out of the menus. We have a list. It started out earlier, about 2 months ago, that there were 3 things on the list that were back ordered. Yesterday, when I checked in the order, it's up to 10 things that we can't get. Simple things like chocolate pudding. Chocolate pudding is not available. Many canned fruits aren't available. So things are changing. Someone had said the other day that it's kind of like a supply and demand, but if you look like at Walmart, they have all those storage containers full of stuff. So really, why isn't that stuff out on the shelf? And it's kind of the same thing, with our suppliers. It's like they may or may not have it, but they're holding it back. But this is kind of, where we're at. And then we just added, because of the budget year, what the previous director got, what I get now as the present director. And then where we started back in 2017, when I started with the double payment, and then the following year, what we hadn't paid back to the county, we got a lesser amount. So we've been working ourselves, and we have in the past, over a year and a half ago, we worked ourselves out of debt, the debt that we were in when I started in 2017. We're there, but with rising costs and the lack of employees, it's difficult, so. We keep plugging away.
Okay, are there any questions?
Prices
Comment?
going up for those who eat these meals, so they used to be $5 a meal, you said, are you charging more now?
Well, the board, at our last board meeting, we talked about changing those prices up to $7. I just recently, this past week, met with all the other, there's 9 of us in the state of Wisconsin that are nonprofit agencies that provide senior meals in counties. And what they've been doing is they do like a price range $5 to $7. We could do something like that. The only difficulty in that is we send out, the monthly donation letters for the Meals on Wheels people. That would be very cumbersome for the secretary that does the invoicing. Okay, if you want to pay $5, this is what it would be. If you want to pay, whatever, we have to kind of, figure out where we want to be with that. Because we can't charge the people that come in one price and then charge the people that are getting the home delivered meals another price. We have to either stick with the $7 or, stay with the $5. The average in the state right now for senior dining programs is running about $3.50. We average anywhere in the county for our different sites, anywhere from $1.30 to $3.41, with an average of $3.36 per meal that we get. That was for the month of September. So it's really a hard decision, to make, and we understand that it's a donation. If you're 60 and over, it's a just a donation. We don't stand there and say, put your $5 in the box. The box is away from where somebody sits at the desk. So it's a kind of a goodwill offering.
Are other counties paying less because they have less seniors they're serving?
No, actually, we're all, the counties that are comparable to us, we actually serve more seniors than some of the counties that are comparable to us. But some of those counties get other funding from other places. Like, for example, I'll use Oconee County as an example because I met with them last week on our call. They get less money from their county, but they get more money from GWAR. Like other counties, well, like Ashland County gets more money from their county than, we do. It depends upon the county, their budget and different things like that, and what their tax base is, so.
And if I understand correctly, and I could be wrong, we can't force the seniors to pay.
No,
We're here to keep them.
that's true.
I have a comment, just a question. Is anyone using their Quest card?
We have not, nobody has asked for it, so we haven't pursued it because it's another layer of accountability. And we're in the process right now of changing how we're doing our claims and stuff like that because our accountant is retiring. And that's something that we'll talk about. GWAR is going to be here doing our annual fiscal audit on October 18th, and we're going to be
If
retaking.
there's anything I can do
No,
to
I-
help,
Yeah, I
with
will,
that?
yeah.
reach out to me
Yeah.
because, households are getting supplemental benefits right
Yeah.
now, and that may be something that they feel that they can afford to do. So
We have not, maybe one, since I've been there, we probably had 2 people that asked to use that, and that's it. One of the things, Inclusa is phenomenal. When we told them that the price of a meal went up to the $14 and something, they actually raised our reimbursement rate to $14.68. So, so some of them are, doing a really good job.
Okay. Thank you. Any other questions? Okay, now we need to approve the budget and send it on to the county board. Is that?
No.
No?
No, I mean, I guess I can just say that. I think Joe was given her report for senior resource. For the budget, senior resource requested $226,000. 226,66, and then we put 200,000 in there in the budget. It's an increase of about $15,000 from last year, but not as much as they were asking for. And I think our intent, obviously the $14 and probably higher than that meal cost is a significant increase. I don't know if that's sustainable, so we realize we didn't put it as much in as they requested, but our hope is that we'll work with them or they'll work with us to look at alternatives
Sure.
to the meal program to bring those costs down.
Okay, so it said possible action. That's why I asked. So we
Okay.
need to take no further
That was
action.
just for the resolution, so.
Okay. Thank you, Joy.
You're welcome.
Where are we at now? Yeah. Okay, Patty, you want to take it from here?
Sure. Administration, this is just the regular report that you're getting every month showing you the tiers of services and what is mandated and what is not. It's just there for your review on a monthly basis. Number 10 is long-term care. Adult long-term care. Maintenance is working as fast as they can on the old Oasis building and moving the staff over there. They are not there at this point in time. We are advertising a position for halftime administrative assistant for the ADRC long-term care unit and halftime for veteran services. To my knowledge, we have not gotten any applications at this point in time, no.
Is that a new position?
It is a new position. Yes,
It's not a traditional position. It's a new position, but it's replacing existing. There was already a position in veteran service.
Okay, that's what I was asking.
Yeah.
It's
We're creating a hybrid.
budget
position,
neutral,
basically.
okay.
they are also working on posting a position. Sawyer County has an information and assistance position for the ADRC. It is a halftime position, and Iron County has a halftime position. They are working and exploring the possibility of the region offering a full-time position between the 2 counties to try to see if we can find anyone that would make it more attractive. And that is under negotiation at this point in time. That's all we have on long-term care.
Yeah.
Behavioral health. Number 11, you have the reports. There is the behavioral health report that is submitted, as well as your mental health cost by client report that you receive on a monthly basis. Questions? Number 12, child protective services. You do have the child protective services report for October, as well as the substitute care report, which is in the packet showing what is been spent out of that. Any questions on those reports?
Thank you. Now we go to 17.
And now the 161 agreement, which we moved up to 12B. I understand that that was requested to be on the agenda.
Yeah, I asked for it to be on there because there had come up as a question as to where we were at the 161. And so I think Mr. Slender's comments, and I'll follow up on those, but otherwise I think the 161 agreement had gotten lost somehow in communications between LCO and the county. So it's been picked back up, and we have our attorney and theirs working to get it back on track. So we can get it approved.
Okay,
When do we expect that to get done?
Hopefully in the month. I just have to find out if the comments that were made tonight are in there, or if we can go back and add them and adjust them.
I speak on that. So I'm Tabitha, I'm the LCO New Child Welfare Director. So the 161 agreement, I think Jim covered some of what it does. It's primarily for the primary purpose is to function as a financial agreement where the county has been the paying agency for foster care placements. It can also be used for other things to kind of, and what we use it for is to kind of help us navigate how we work together between Sawyer County Health and Human Services and the Tribal New Child Welfare Department. So that's one of the purposes that it does there. So there are some revisions that have been made. There was some language that was taken out because it was dated to the point that nobody could tell me why it was there. So we took that out. We are adding in language about the qualified residential treatment program because currently the agreement that you have that's standing does not address QRTP. So there's a federal piece of legislation that came through for the Families First Transitions Act. And currently, if we were to follow just the plain 161 agreement, the tribe could place children wherever we wanted to, whatever kind of residential facility. The county would have to. The QRTP is required if we want to have any kind of foreign reimbursement come back to the county. So it was really important that we get that addressed.
Mm.
So we've added language into that. We're also looking at it again. Carl and I talked about this on Friday about wanting to add in language regarding subsidized guardianship payments. Because currently that's not addressed in 161, the counties pay that. And that's a cash allowance that's paid to people that take guardianship of children who've been in foster care. So I just want to make sure we add that in there as kind of a safeguard for us so that it's clear that that's what's going to happen. Because there are certain things that we're going to have to do, like findings that have to be made, processes that need to be followed in order for that to qualify for a subsidized guardianship. Those are some of the changes that will be coming, that's not added in, so we're still like revising back and forth. I think our attorneys are looking at it now. Once we get that added in, we'll send it to TJ, he can look at it, and then when we're finally satisfied with it, I will sign it, Paul will sign it, and we'll bring it to our tribal governing board for their signature, and we'll bring it back to this board for that signature as well. So that's where we're at, but I kind of really would recommend that maybe that stay on the agenda until it's completed, so it doesn't get delayed again. This should have been done in February, and it's now October.
okay. I was going to ask, are you going to be able to accomplish all that by next month?
Was that?
Are you going to be able to accomplish all what you're talking about in a month?
I think that depends on the attorneys. I wouldn't say for sure that it will be done.
Mhm.
I would hope that it would be, however, it's not, it needs to stay on until it's done.
Do we need to take any action on this? No, okay,
We just put it on future agenda items.
okay. Thank you.
Thank you.
Youth Justice,
Yeah,
you have the Youth Justice report. Showing the pending youth and the justice system as well as the current youth.
mhm.
Number 14, economic support. You have your economic support update report from Shauna, and Shauna is here tonight if anyone has any questions on that.
Anybody online have any questions? Doesn't sound like it.
Number 15, public. And Julia is going to speak to us tonight.
Good evening. Okay, first off, I have the updated report. Does anybody have any questions on that? Not, we're gonna go into board orientation. So we can jump into the PowerPoint slide. There we go. Okay, so the first slide here is showing WALDAB, which is the Wisconsin Association of Local Health Departments and Boards. Think of this as an association like the Wisconsin Association of Counties. They help advocate for us and move things forward with the state. There is 100% participation with local boards or local health departments and boards on that. So all 72 counties, and there are a handful of tribes that also participate in this as well. With that, we have board representation from each of the 5 northern counties on the board, and on the executive board, there's co-presidents. So it is a health officer and a board of health member. There's outgoing co-presidents, and then there's the incoming co-president-elect. So I am actually co-president-elect of the board as we move forward. So this report has been put together for local health departments to use to help orient boards as we move forward. So we're going to talk about what local health departments are, our responsibilities, how we partner with the public, and the responsibility of the board themselves. So we'll slide into what does a local health department do? And the next slide talks about us being really responsible for the health and well-being of everyone who lives, works, and plays within our jurisdiction. We are to prevent, promote, and protect the safety of our community and create a healthy community for us to live in. One of the ways we know how healthy our communities are is by looking at a number of factors. And on the right on this slide, you'll see a diagram that really shows health factors that lead up to health outcomes, so length of stay and quality of life. Every year, there is a county rankings report that comes out. So this is nationally, every county is looked at, and then there's a comparison done within Wisconsin. So we're ranked amongst our 72 counties. So when the community health assessment was done and the plan, which I have linked into this. So if you haven't had a chance to look at it, I know I handed some books out earlier, but that really looks at the assessment, where we are in our rankings and things that we need to work on. So when we look at our health outcomes, we are number 68 out of 72 of the counties and 66 out of 72 on health factors. That actually the health factors are improving. Health outcomes are always a lagging data point. So hopefully we're moving in the right direction as we move forward. If we want to talk more about this, I can bring this back to another meeting because there's a lot of information there, but just wanted to set you up with understanding that. Yes.
So we're not doing so well.
We haven't been for a lot of years. Yeah, a lot, and some of the things, and we can bring this back to talk more about, but social economic factors do definitely play in there, as well as health behaviors. So for our county, physical environment, we have great physical environment.
I've seen a lot of these reports.
Yeah.
About 17 of them, and we always have been.
Yeah, so we're trying things a little bit differently this time around, doing a coalition with the hospital, building our steering committee in a different way, and hopefully we can start making some impact as we move forward. The next slide really talks about us being a health strategist, a community health strategist, and really this is where public health is going. Those of you who are a little bit older and have been around back in the 90s and even early 2000s, really we had public health nurses that were going out and doing new baby visits. We were doing a lot of hands-on care and a lot in people's homes. Now there are other resources and things available. There are immunizations that are standardized and happening at your well child checks. We don't need to be doing all of that hands-on work, but what we need to be doing is linking all of the community partners together to work as well together to really get a bang for our buck and all the resources that we have. So that is really where our focus is and where we're moving forward. So then when you look at what are the unique responsibilities of the health department, this is going to get a little tedious, probably. There's a lot of statutes and a lot of language that I'm going to try to hit some of those key points for you that you should focus in on now, and then we can dive in at later meetings if you want to know a little bit more detail on certain things. So this is a model that was introduced in 2019 into Wisconsin to be used. It's the Foundational Public Health Services. So basically what this does is set up the minimum set of services that health departments need to provide. I'll go through more detail as we go through the slides. This is kind of just a brief overview on this one. And as we look through, we have statutes. So we have statutes from chapter 250 to 255. So this book is all the statutes that really we need to follow. So we're looking, when we look through and we're following these and identifying things that we need to work on, the state has been identified to work on things from federally to the state, and then the state pushes down to local health departments. The other piece that we need to look at is DHS 140, which is an administrative rule. This administrative rule outlines the services that that every local jurisdiction needs to have. There are 3 levels of health departments that you can have. You could have a level 1, a level 2, or a level 3, and those are all outlined in the administrative rules. We are a level 2 health department, and a little bit later on in the slides, I'll go through what a level 1 and a level 2 do. The one thing about these different levels is when we jump into like the community strategist and really looking at different things that we're working on, that's really more outlined in level 3. We can still do that. We just don't have to hit all of the things in a level 3 has to have. Questions on that? You'll hear more about 140 in 2023 because we have our evaluation then. Okay, so how we carry out our services is the next slide. And that is through the 10 essential services. So this one I'm going to take a little bit more time to go through and just kind of give you examples of what falls under there. So when we look in assessment and we look at number 1, we are to assess and monitor the population health status, factors that influence health, the community needs, and the assets. So this is part of that community health assessment that I was talking about that we do. We not only look at the health rankings, but we look to community members. We do surveys, we do focus groups to really dive in to find out what the community health needs and assets are. So, and then under assessment number 2, investigate, diagnose, and address health problems and hazards. An example of this would be if we had a report of a foodborne illness and then we saw a couple more coming through, we would really do further investigation to determine if there is a foodborne outbreak. If we identify that it's all coming from one location, then we're going to go in and investigate what caused it and then put in plans to mitigate that from further happening. So that would be part of those. Under policy development, we need to inform and educate people about health factors that influence our health and how to improve it. We need to mobilize community partnerships, which we've just talked about, and create and champion and implement policies, plans, and laws. An example of this right now is the school districts have let us know, along with law enforcement, that there's really vaping is becoming a large issue within the schools. Head nodding. And so what we have done is we're pulling together law enforcement, the schools, medical providers, and working actually through LCO University. We will be having a vaping panel on the 26th of October to really inform the public of what is happening, ways to be able to identify use and why we want to keep that out of our youth right now. And then from there, I know that they also want to be looking at some policies or potential ordinances related to vaping with our youth, because the tobacco ordinances that we have in place do not say nicotine. They only say tobacco, which prevents law enforcement from following up. Yeah.
And Juliet, can they vape THC now too?
Yes, they are vaping THC and other things, and kids are having some health issues in school and out. So yes, that's just one of as things come up, gives you kind of an idea of what we do. And then when we look through assurance, using our legal and regulatory actions to improve and protect. An example of that is we have a human health hazards ordinance in place. So we use that when we identify any human health hazards because that allows us the ability to have people clean that up. And then under insurance, number 7, assure effective systems that enable equitable access to services and care, build and support excuse me. And then with that, we're working with Hayward Hospital on the access to care. We know that there is not as great access to care in the southern part of the county with services. So when we're doing our healthy communities, we'll be specifically looking at the southern region, how we can help with transportation or services in that area. And then 8 through 10, building a diverse skilled workforce, improving and innovating through quality improvement, and building a strong organizational structure. We have been very fortunate here. We have had very little turnover. I still have core staff in place, which very few health departments have that in place post-COVID. So very lucky to have that team. This year we started reevaluating what we're doing, and in 23 we'll re-update our strategic plan and bring that over to you guys so that you can help us as we move forward. Questions on essential services? Just a lot of examples. Now we get into really the level 1 and level 2 requirements. So again, we're a level 2 health department, but we do have to fulfill the level 1 requirements. And these align with statute 25105. The other thing that we just had gone through was the 10 essential services. So that is something that we need to align with, along with the foundational public health services model. We need to do health promotion, which we've been talking about. We need to engage in preparedness and response. On my report today, I noted that all of our HHS staff are updated in incident command training, and we'll have a tabletop on November 2nd. Public health nursing needs to be embedded throughout. We do have, I'm a nurse, and I have 3 other nurses working in our department. So we are fully embedded with public health nurses, and we need to report data in a specific way to DHS, which we do. And then we move into level 2, and this goes back to those foundational areas where and the statutes where it talked about communicable disease, chronic disease, injury prevention. All of these things are requirements that we're already doing. We also need to have a workforce development plan. We have to engage in quality improvement, which actually is my background before I came here. Doing performance standards, and again, embedding public health nursing. So that's what's required of level 2. When you start getting into a level 3 health department, it also is required that the health officer does have a master's in public health, which I do not have. So we're not applying for that unless you replace me. And that would be one of the things that you would need to put in place. We're probably doing a bulk of the other things in a level 3. Okay, any questions before I get on to this next spot? Yes.
Do we get any extra funding for being a level 2?
We do get some extra funding for being a level 2. Which
Yeah,
is
we
why
would
you
go
want
for
to,
a-
yeah, I'm not sure the differential in that. But yeah, probably would.
And are the levels are all population based?
Yes, well, no, levels are
No?
not population based. Funding is population based, but not levels. Other questions? Okay, this gets into the nitty gritty of the work that we do specifically here, and goes into some of the clinics that we have. So you'll see that I have surveillance and investigation across these foundational areas. And again, those are the foundational areas that we're required to do. Surveillance and investigation under most of these. For communicable disease, we have an electronic record that all labs, hospitals, and clinics need to report specific communicable diseases to, and then that gets pushed out to the jurisdiction for us to investigate. And we monitor that. We have specific investigation guidelines that we have to do based on the particular communicable disease. So that takes a bulk of time to work through. In addition, we do SDI and STI testing, which we talked about at previous meetings, but we just do gonorrhea, trich, and chlamydia. We are looking to add hepatitis C, HIV, and syphilis, being that those syphilis rates are so high. That is a blood test that we need to add. It takes equipment, lab equipment, working with the state lab. However, we received additional grant funding this year that we're able to move forward with that without an additional hit to our budget. So we're taking advantage of that while we can. Yes. Oh, I thought you had something. COVID-19 testing, we're doing that because the hospital did have drive-through testing and they needed to stop that. The clinics weren't able to take it on, and LCO Health Center couldn't do our whole county. So that's something that we took on for right now. We'll do it as long as funding is available. It's fairly limited at this time. Other things that we would do related to communicable disease is we send in vets for rabies testing and work with vets on other animals who need rabies testing to get those sent down to the state lab of hygiene. We work on health promotion, and we do mass flu clinics in the schools in the fall. Other things we do under chronic disease and injury prevention, besides health promotion and events, we're working on looking at the numbers of support groups available in the communities. We've been hearing that they're limited, or people don't know that if they exist or not. So working to get that pulled together, getting those resources out, and then we'll work with partners to set up ones that are missing. We refer to the Well Women program, and this is and the child death review team would be something that may be of interest. So we take every death of age 28 and under, and we have a child death review team. So it's a combination of the coroner, the health department, and providers. We have clergy as well that kind of pull together and review those deaths. We're looking for injuries that could be prevented. One thing that was of note a few years ago, there was a couple of carbon monoxide deaths in Sawyer County. A lot of health promotion was put in place to help mitigate those additional deaths that may occur from carbon monoxide. Another one that this is the other way that this works is the information and the data goes up into the federal database, and then they use that as analysis. So they were finding years ago, has taken effect, that they were finding that there were children drowning in pools. They were getting sucked into the filtration system and they couldn't get out. One of the acts that went into place was to make sure that there was protection around that filtration system to make sure that those deaths no longer occur. So those are the types of things that can come out, and that's why we do the child death review. Maternal child health, we have the Women, Infant, and Children Nutrition Program, which you've probably seen me report on. We have Birth to 3, which is, we have physical therapists, speech and language therapists, occupational therapists, and teachers working with children 3 and under in their home to help get them up to their development. We also assist with school health. We have a reproductive health clinic, and we're just getting our blood lead screening back up and running. And then we do linkages to healthcare. Every other Monday, I have a call with our hospitals, clinics, and long-term care agencies to make sure everybody is up to date. We also take in calls from the community and link them to insurance or consult with them on places that they could go for clinical care. So that was a lot on that slide. Any questions? Okay, so this slide really talks about the public health standards. How do we know we are doing what we're supposed to be doing? Every 5 years, the state comes in and does a 140 review to validate that we are a level 2 health department. That occurred in 2018, so we will be having a review in 2023. So like I said, we'll be talking about the 140 again. The other thing that we can do, which we haven't looked at historically from the health department, is to become accredited. When we're looking at the 140 review and the accreditation standards, we are going to be looking at those and connecting those together internally. It's really expensive to go for an accreditation. It's well over $5,000 just to get your foot in the door. So a lot of health departments really can't afford to move that way. If you decide as a board, we want to move that way, we can certainly look at that in future budget years. But at this point, we'll really be doing the assessment as we move forward. Okay, and getting into your jobs. A Board of Health is a governing body for the local health department, and that governance varies across the state. So there are actually 85 local health departments, and most happen to be county, but some are multi-county, city-county, multi-village. They can mix and match together in a number of ways. And then the membership that we have is dictated by Chapter 251.03. So there's 9 members and 3 are from the community, non-elected officials. And then we are in good faith to have a position, and Dr. Dunlap fills that role for us. And then the 251.04 outlines the powers for the duties. So you're really, when it says to govern, it's really to help us develop policy. Which direction do we want to go? Do we want to be looking at syphilis? Is that important? I've been hearing that it's important as I've been at these meetings, but different things as they come forward, we'll bring that to your attention and find out if that's a direction that we want to move into. Again, to assure that we're at least a level 1 at minimum health department. You can adopt your own regulations and guidance, but they need to not conflict with state statutes and need to meet at least quarterly and meet monthly. So we do meet that. The other thing that boards are responsible for is really assessing the public health needs and advocating for public health services as we move forward. You'll get a lot of that information in the reports that I'm given so that you'll know, where do we need to move our services as we move forward. Being able to, this next one is very lengthy, but it's really meaning that we really want to connect community partnerships. We don't want to be duplicating services. We want to be just enhancing and filling the gaps when it comes to public health services along the way. We want to ensure that there's an environment for individuals to be healthy in this county. And then unless specified otherwise by ordinance, we have to employ qualified public health professionals. So that is really your role. And then this next slide gives us kind of some resources that we can lean into. I already talked about WALDAB. You will also, you all are members because you are on the board, so you'll be receiving updates from WALDAB moving forward. Usually they have a monthly newsletter that comes out. And there are other associations that we can get resources from along with the state. So, did I confuse you? Do you have any questions? It's a lot of information to get out in what we do.
Thank you.
Okay, you're welcome.
Hey, Ms. Lyons?
Yes.
Yeah, it's Jess Betcher. Hey, thanks. That was very good report, very comprehensive. I just wonder if you can clarify what Mr. Schuman was saying. I couldn't really hear him too well on his mic. Something about fentanyl or candy or something like that.
Yes. I can't, rainbow fentanyl. I was like, I had to remember what that was called. Yep. So rainbow fentanyl is, we did put out a health alert on this. It looks like, it's 2 things. It can either look like colored candies. Yeah, it's too bad we can't get that up on the screen. We'll maybe send that out.
It looks like Skittles.
Oh, yes, it can look like Skittles. It also looks like regular medication that's been stamped, but it's in different colors. So it looks like it could be real medication because it has a stamp on it, but it's not. So Definitely something that we're seeing coming forward. We can put a
Okay.
picture of it in our report next time.
Okay, thank you.
Mhm.
It is, I wasn't sure, but is Narcan effective on fentanyl?
Yeah. But fentanyl acts much more quickly, so, yeah, it can bring you down pretty fast.
And it's still effective with kids too, because
Yeah, and actually, we are, I know the school districts are all looking at getting Narcan training within the schools. So LCO might have already done that. I know Hayward and Winter were looking at getting all staff trained on Narcan and having Narcan available within the school,
Julia,
especially with the vaping. Yes.
the reason why this has come up is because of Halloween. It's been coming across the border, and that was the whole reason why the cartel brought it across, because of Halloween, that they could get it out, and that's why isn't that why that became public notification, because they're worried about Halloween trick or treating?
Well, that's probably an additional piece, but we started reporting this out probably 3 months ago that it was brought to our attention. But especially now, it would be important to continue to get that message out.
Very much so.
Thank you, Julie. Okay,
Number 16 is fiscal. You have the budget performance report in front of you. And that is through August, as well as the purchase service recap, showing the purchase services are where the bulk of the money is in our budget. And this highlights it by the budget areas of what the budget was and what has been spent by month to date. Yes.
Okay. Chairman, Patty, how are we tracking for the 22 budget? With like our mental health placements and Howard County expenses. I was gonna look at that. You breezed right through that before. Are we on track or are we over budget, under budget?
Well, our Mendota is only, that we're reporting here is only for 4 months. They're that far behind in Mendota / Winnebago. So the state mental hospital is 3 to 4 months delayed in billing. But going out on a limb with moving someone who was permanently placed in Winnebago to a residential facility, we are looking hopeful this year.
Because I see your total annual projection is 2.1 million, right, or 1.7?
Right.
Is that about what we budgeted?
Well, the total spent is 2.5 and we budgeted almost 5 million, 4,948,000 total for purchase service for the agency. I think where you also need to look is at our out of home placements, because through August, that's only 8 months in, just in foster care, we've spent almost $166,000 out of 200. So, I mean, we're right up there with those things too. But overall, I can confidently say we'll be within budget. I'm highly optimistic that we will be a bit up there. If everything progresses as it has been.
How did this 161 agreement then affect the budget?
It doesn't. We have been spent, I mean, really, it doesn't, because the 161 agreement just outlines the working relationship between Indian Child Welfare and the county Child Protective Services unit. It also does state that Sawyer County will pay for the out-of-home placements, but we do now. So, I mean, we're paying, I mean, that won't change anything as far as the budget. Because Indian Child Welfare places, we pay, and that's the way it is now, and that's, nothing would change going forward.
The county pays if they're placed out of county. correct, or both?
Oh, anything. Yeah,
Mhm.
we pay for all out-of-home placements. Yeah.
Okay.
Always have,
have.
yep. So that hasn't, I mean, that, yeah, so budgetarily, it's not. you know, for what-
I think it formalizes what's already going on, or,
Exactly,
because I think there was one, I would call it level of care that's not listed in the current agreement that they can place into. We still incur the cost, it just isn't identified in the current agreement.
Any more
I'm glad
discussion?
that they're clarifying a lot of the responsibility and the different levels. It's gonna help the workers a lot to follow through and make sure that. Well, they always accomplish their goal, but I think it's gonna make it easier for them to do the steps. Yeah,
Agreements like that come in really handy when things are not going well.
right,
You have something to fall back on.
right,
It's because you didn't incur it, right?
it's cleared it up. Right.
the 2023 budget update. Is that what you're here for, Mike?
I think so, yeah. I'm enjoying it though. The only thing I've really got to report on for HHS, they came forward with a nice budget that really was just a continuation of what they were doing for the working. No request for new staffing or anything, nothing out of the ordinary. So the only thing I've got for an update is at the last county board meeting, I mentioned we're working on health insurance. We were able to save some money. And the HHS portion is about 26,000. So that'd be a little savings from what was presented before.
Good.
We're going into the. As long as we can keep the course for the rest of this year, we're going into next year and a little bit more consistent. So this year you refill with their, basically the reserve fund for placements. Use that. So we haven't had to check that this year. So that's there, pretty replenished. So as long as things stay the course, we'll be in good shape.
And we replenished with our surplus?
Correct.
Yeah. Good.
I think you've already, I mean, next year, like Mike said, it's pretty much status quo going into next year, but obviously we'll have some moving pieces next year that we already heard about. Some retirement and things in the program and that. We'll be able to be flexible. That's the whole thing.
What's phenomenal to me is how you've lowered the cost of health insurance.
We didn't lower it, we lowered the increase.
We lowered the what?
The increase.
Yeah,
Lowered the increase, yeah.
we had budgeted kind of all the history had gone.
Mhm.
We've had a pretty good year with utilization, actually been 2 years now. So we were able to negotiate the rate down substantially from what they presented us.
Mhm. But what is the percentage increase?
We have 4 in the budget, but we're really probably gonna get 2.5. Which is pretty good in this day and age. Just cost of care increases 6 to 8%. So if we have the same claims from one year to the next, the cost will go up 6 to 8%. So to get a 2.5 is pretty.
Yeah, oh,
Pretty good
very good,
position.
very good. I remember a lot higher increases. So do you.
Oh,
Yeah,
Yes, Chairman, I got one more. Was HHS staff included in those retention bonuses or those increases?
very much appreciated. Yep.
okay, yeah, future agenda items. We already have the 161 thing on the next month. Anybody else?
Board members stick around to sign the resolution.
Okay, we're done.